Alright, so this is my reflection in the gynae ward. My name is Raja Muhammad Shakir, and this is the reflection for the first week. So for the first week, I've been introduced to the gynae ward, and the procedures that I have done was ND feeding, transfer patient from bed to chair, ECG, and also assisting sister in wound packing. For me, the challenging part is the transfer patient from bed to chair, since I am a small person and the patient is bigger than me, and I am the only male, so I need to help the patient to transfer from bed to chair, and it's quite challenging, but I managed to do it safely and correctly. And then assisting sister in wound packing, because the wound is quite big, and for us students we couldn't do it, so that's why we only assist the sister. And after all, it's a great exposure for us to help the sister. For the week for this trend, I managed to revise more on procedures, and the sister and the staff nurse has taught us a lot in this ward. They are very kind, and we also able to follow the new SOP for the prevention of the COVID-19. We had to wear apron all the time, face shield, and also face mask. And we also able to see patient with gynae cases such as patient with cell, rectal cell, and also hyperemesis gravidarum. So for the weakness, actually this posting is more focused on MS and procedures rather than ONG, and we only had a short period of posting since we only had 2 days due to our problems regarding our practicum. And that's all. Thank you.
The procedure I have done in the gynecology ward is perform ECG, care for patient with blood transfusion, and care of patient after surgery. For ECG, the strength is I able to communicate with the patient throughout the procedure to make sure the patient is comfortable and do not feel anxious. Then I make sure the patient have removed all the generalities before I start the procedure to make sure the reading is accurate. And after that, I able to do the procedure by myself confidently. And meanwhile, for the weakness, I did not check the machine if it's functioning well before I called for the first patient. I end up making the patient wait for quite some times. Then, care for patient with blood transfusion. The strength is I make sure to monitor the patient every hourly to check for her vital signs and any adverse reaction during the transfusion. Meanwhile, for the weakness, during the first hour of blood transfusion, I forgot to ask my other teammates to help me checking for the patient vital signs, since I'm taking care of the cubicle. Because that time I follow staff nurse to collect patient from the OT. Next, care of patient after surgery. The strength is I make sure the patient is put in comfortable position after back from OT and help the staff to change the patient clothes. The vital sign was checked immediately to find if there is any abnormal reading since the patient is on epidural anesthesia. And then I informed the staff that the patient BP reading is low. After 30 minutes, I recheck the patient vital signs and inform the doctor because the patient BP is still low. Then the doctor immediately asked the staff nurse to run Hartmann solution bolus. For the weakness, I did not ask the relative to inform the doctor or nurse if there is any abnormal about the patient condition.
Hi, my name is Zainab binti Sofian. So this is the procedure that I have done during the past 2 days in gynae ward. The first one is basic nursing care and ward routine such as vital sign, bed bath, and perinatal care. The second procedure that I have done is care of patient after the operation. The patient need to be monitored every 30 minutes until stable. I also need to ensure the patient having a balanced fluid and electrolyte. I've encountered one patient who is having low blood pressure after the operation, so the doctor has ordered for 1 pint bolus of Hartmann solution to increase her blood pressure. I also have opportunity to care of patient on blood transfusion. I need to monitor the patient vital sign and observe any adverse reaction every hourly. The strength throughout these 2 days, I am able to maintain strict hand hygiene and follow current SOP of the ward, where all of us need to wear masks and face shield every time in the ward. We also need to wear proper PPE when having close contact with patient. Besides, I also feel confident in delivering basic nursing care to patient because the procedure is very common, and I am able to document every procedure in right chart and inform the staff nurse if there is any abnormality detected. For the weakness, The major issue is limited time in clinical area. Due to this issue, I am having difficulty to familiarize with the ward environment and does not have enough time to build rapport with the staff. In addition, I also don't have opportunity to explore more regarding the gynae case and its management, and lack of time also make me unable to improve my nursing skills such as insert granula and catheter.
My name is Aris Eliska Anai Clement. This is my reflection. For the procedure that I have done in the gynae ward is first taking vital sign, doing ECG, giving a IV medication and bed bath. For the strength, I able to enhance my skill in the basic procedure, able to practice strict hand hygiene and follow current SOP. Besides, the staff in the ward is very nice and keen to teach the student. For the weakness and limitation, I think that we have a short time of fasting due to we need to withhold our fasting due to the current pandemic. And then there is more MSN procedure rather than ONG procedure.
Hello, my name is Farah Nurmiza binti Halid, and this is my reflection report for my first week in gynecology ward. On my first day, we were given orientation by a sister. After that, our leader divided us into smaller groups that are responsible for our own cubicle. In my cubicle, we just perform observation and looking for case studies. On the second day, we were a little more hectic. I able to perform care for patient during blood transfusion, insert CBD, care for post-operation, and administer IV medication. For care for patient during blood transfusion, I able to determine the abnormal result from her vital sign. However, sometimes I miss the timing, especially the 1 hour observation during blood transfusion, so I should be more alert on timing. For insert CBD, I know what I have to do during the procedure. It's just that my friends still need to help me to prepare for the requirement for the procedure. I also have poor planning because when I was trying to insert the catheter, I forgot that my lubricant is on the trolley while I already on the bed, so my PI have to help me. In order to overcome this weakness, I should revise about the procedure so that I can prepare the requirement myself. I should also plan ahead of time so this incident would not happen again. For care for post-operation, I realized that I helped the staff nurse to perform it faster. It's just I need to follow her instruction instead of doing it myself. So I should revise a procedure so that I don't have to follow others' instruction and just do it by myself. Lastly, administer IV medication. I able to administer it with the supervision of my PI. However, I need her help regarding certain steps. So in order to overcome it, I should revise about the procedure so that I can do it by myself. That's it. Thank you.
This is AB Bridget Anna Joseph, cut matrix 63005. The procedures that I've done are administering intravenous medication, which are pantoprazole, tazocine, and sulfaroxime, performing health assessment on the patients, performing denture care, performing 12-lead electrocardiogram (ECG), performing post-operative care, preparing surgical bed and anesthetic tray, monitoring vital signs, and measuring and recording intake and output. My strengths are I always prioritize the patient safety above all. I'm very knowledgeable, but I love to learn from others. I'm a team player and communicative to all of my team members. I'm proactive as I love to learn new procedures and hardworking as well. And lastly, I'm able to take criticism very well. My weaknesses is that I have difficulty in applying theory to practice. Although I'm knowledgeable and get good grades for exams, I seem to have difficulty in applying what I learn into practice. This causes me to be inconsistent in performing procedures. For example, some days I perform the procedures very well, but some days I tend to be clumsy. And this in turn causes me to have low self-confidence in performing some procedures. And lastly, I also have poor dexterity. This is shown as when I hold syringe or needle, I tend to have tremors.